what really got me decided into medicine was that I also played piano throughout high school. And then we often performed at nursing homes. But then I wanted to, I don't know, let's say, I think, like take a greater responsibility in the care of patients. And so what I did was I started shadowing physicians. And then my piano teacher's husband was also a physician who performs with bands on the weekends. So that was really inspiring.
Hi everyone, I'm Brooke, and on behalf of MDF Instruments, I would like to introduce you today to Matt. Hi Matt, how are you doing?
Good. How are you?
I'm so well, thank you so much for doing our podcast today. Really
Of,
appreciate having you on.
of course. Yeah. Glad to be here.
Awesome. So can you tell us a little bit about um, your medical background, what you're doing? I know you just graduated, I think, right? You're a student?
Right, correct. So I just graduated from UC San Diego this past March, actually. So it was right before all the COVID-19. So I was fortunate to actually have all my classes complete before like all the online classes took over. So that was nice. I graduated with a BS degree in biochemistry. So uh, it's definitely, it's been a journey taking all
Well,
those classes.
congratulations
So
on graduating.
yeah,
That's a huge accomplishment. I know
thank you.
a lot of people have been graduating, in May, and then they or they still have one more year left, and then they're having to
Right.
deal with all of that. So it's nice that you were able to get through without having to deal with that.
Exactly. It was almost like perfect timing. Like I'm done, and then all of a sudden, oh whoa, everything's going online. Um,
Wow. Did it
so
affect your graduation?
it definitely did. So my commencement is, I guess you can say, it's indefinitely canceled until safe. So commencement was canceled. I was actually really looking forward to that because walking at graduation and then celebrating with friends. Was really looking forward to that, but unfortunately with COVID, everything got canceled. So, I mean, I still had like a mini graduation ceremony with my friends on Zoom, but obviously that's not the same as if you're at the ceremony, walking on stage. So,
Absolutely.
yeah.
Yeah, that's a bummer because you work so hard and it's such a big moment. But I know that you have more schooling left, so you'll have more graduations, right?
Yeah, hopefully not canceled this time.
And hopefully not canceled. Hopefully by then we will not have to do that. I'm sorry. That's a bummer.
I mean, it's okay. It's not too big of a deal. I still got to celebrate with my family, with friends online. Um, but I mean, hopefully, I think they will bring back commencement once COVID-19 settles, and hopefully they find like a vaccine. Um,
Yeah, I heard that they
but
were thinking about, and this is just some universities were talking about doing a graduation for 2020 and 2021 exactly the same day, just the year later, and doing it like earlier in the morning, and then doing um, the other graduation with 2021 just later in the
oh,
day. So I've heard some universities
okay,
talking about that, hoping that they can actually give the commencement the proper thing that it deserves, the proper
right.
attention and the way that everybody can come together and celebrate because it is such a big moment and a huge accomplishment.
Hmm. I mean, I think specifically UC San Diego said that once like classes reopen again, maybe winter quarter, they're hoping they can have like a ceremony for the class of 2020, but obviously nothing's for sure yet. So
Yeah,
yeah.
just have to wait and see what happens. Fingers crossed.
Hmm.
So you said
Yeah,
you
fingers
did
crossed.
biochemistry, is that right? That's what you majored in?
Yes, so I majored in biochemistry at UC San Diego. And yeah.
Did you know right away when you entered college that that was what your major was going to be, or did you end up like some students do, where they start thinking they're going to major in one thing and then they kind of switch their majors, or did you always know biochemistry was it for you?
Well, so I actually entered UC San Diego as a biochemistry major, and I graduated as a biochemistry major. So I didn't have like too many changes or anything. In high school, I really enjoyed, I actually liked chemistry more than bio, but then I just I just wanted to learn more about like the metabolic processes. like in the body. So I decided to choose to major in biochemistry, and then that ended up being like the perfect fit for me. So that was great.
Yeah, I guess so. If you started with biochemistry, coming into the university as that and leaving as that, I think you were on the right track from the beginning. That's amazing.
I mean, there's obviously, some classes you won't do as well in, or like some classes that you don't like, but and that's like with every major. So I think,
Mhm.
um, yeah, overall, I think biochemistry was a pretty good fit for me.
How did you get through the classes that you really didn't like or that you kind of struggled in? Did you have a system of extra study time or a way to get through the stuff that you were kind of struggling in?
Well, I mean, there were classes that I didn't prefer, but it wasn't anything that I like hated or anything. So it wasn't like that hard to just like if it was a class that I had more difficulty in or something that I wasn't as interested in, then I would try to spend more time in that class. Like go to office hours, try to be more interactive with the material. I think that helped kind of get through it and then try to like build interest in that subject.
Absolutely. And so I know that you have started the process of applying to medical school.
Mm-hmm.
Can you tell us a little bit about what that process is like and when you started it and how long that process is?
Yeah, absolutely. So the medical school application process is very long. So there's different stages. There's a primary application, which opens in the end of May, and that includes like your personal statement, where you answer like, why do you want to do medicine or why do you want to go to med school? And then there's like a few other sections, but the major other section is you enter your 15 activities and experiences where you talk about, let's say, your clinical experiences or your research experiences, or let's say community service. And then after you submit your primary, what happens is AMCAS is like the application system. They have to verify your application, and that can take up to several weeks. And once that your application is verified, then med schools will receive um, your application essentially. And then what happens after that is that they'll start sending you secondary applications, which are basically each school will ask you, I don't know, maybe like 3 to 6 questions to basically get to know you more. So they'll ask you like why you want to come to our school,
Mhm.
or like please show us like like a experience, or like show or please explain like an experience where you showed resilience, or just trying to get to know you more as an individual. And then after that, this is basically the stage where I'm at right now, where I submitted my secondary applications, and then you essentially wait. It's like a waiting process now, where med schools will start reviewing your applications, both the primary and secondary. And then once they seem like, if they like you on paper, essentially, then they'll send you an interview invite. And after you get the interview invite, then you get interviewed. And then if they like you more, or if they still like you, then obviously they'll give you an acceptance, or they may put you on the wait list, or unfortunately, some cases you might get rejected. So
Wow.
that is pretty much the med school application process. Um, Again, it's a really long process, and so it's like a lot of waiting in between stages. So yeah.
Absolutely. Yeah, that sounds a really like a extremely long process. So when you said you started the process in May, did you start the May after you graduated, or do you start the May your junior year, like when people are in high school and they
Mm.
start applying to college early? Is that similar for med school, or does that happen after you graduate?
That's a great question, actually, because I actually didn't know about this until maybe like sophomore year of college. But the med school application process is completely different from like when you're applying to college. So when you're applying to college, you apply your senior year, right? And then you attend your college the following year. But for med schools, it's if you want to go to med school right after your college graduation, then you have to apply in the May of your junior year. So essentially, you apply the year before. So for my case, since I'm applying my senior year, I will be taking like they call it a glide year, where um, from 2020 to 2021, I I'm not taking like I'm not enrolled in any classes, if that makes sense. So if I apply as like for my case, if I'm applying, uh, let's say June 2020, then I would be applying to enter in July of 2021 or the fall of 2021. So there's always that gap because the med school application process is very long. So I
Mhm.
think there's always that gap where you submit your application and then you obviously have to wait for like your secondary and then your interviews. So there's the following year you kind of go through the process before you start attending.
Yeah, it sounds like you need some buffer there because it is such a long
Hmm.
process. So did you purposefully apply after, like you wanted to take that time, or did you just not know that it was an option and so you, in hindsight, you would have applied earlier?
No, I actually knew about it. So I actually wanted to take some time off from school. I had plans for like traveling and maybe continuing working as like a medical scribe, but obviously with COVID-19, all that is canceled.
Yeah.
Um, but I actually knew about it. I didn't want to rush the process. So I
Mhm.
just kind of wanted to take it a little slower. It's not a race, obviously, to get into med school. So I wanted to take it a little slower, take my time, and then maybe build some more experiences before I start attending.
Yeah, and I think that's really great advice. Be also just because you're in school for so long. I mean, not only do we just
Mhm.
grow up and have to go through the whole process until high school, but then when you go to college, it's 4 years, and then med school is about 4 years, can be 3 or 4, is what I understand, and then residency. So,
Right.
you're in school a long time, and I'm sure that there's burnout, and you got to enjoy your life in between. So, I think it's great advice to just do what you did. I think is very smart to apply and then give yourself that little buffer time to enjoy all of the hard work and fruits of your labor. And if there wasn't COVID happening right now, obviously that put a little
Be a lot better.
kick in
Yeah,
for you, but still you can enjoy your time with your family, your friends,
exactly.
even if it's through Zoom, and just take that time to kind of rest, because I think med school is, from what I've heard, extremely difficult, and I'm sure you need to kind of gear up and prepare. So
Hmm.
I think, like you say, it's not a race at all.
Exactly. Yeah, I mean, you shouldn't, everyone has like their own unique path to medicine. It's not like, oh, this guy is doing it like without taking a glide year. I should also do that. And it's not anything like that. It should just be solely focused on like your path. So I think that's important too.
That's really great advice.
Hmm.
So where are you from originally? Are you from California originally, or are you from somewhere else?
Yeah, I was born and raised in Los Angeles.
Awesome. So you just stayed near home when you went to the.
Right, exactly. Not too close, not too far. It was like right there.
That's right, just right.
Just right, exactly.
Did you know, like, growing up, that you wanted to pursue medicine? Has this always been a passion of yours?
So in high school, I preferred like STEM over, let's say English or history. So I always wanted to pursue something in the STEM field. And then what really got me decided into medicine was that I also played piano throughout high school. And then we often performed at nursing homes. But then I wanted to, I don't know, let's say, I think like take a greater responsibility in the care of patients. And so what I did was I started shadowing physicians, and then my piano teacher's husband was also a physician who performs with bands on the weekends. So that was really inspiring. And then, a buildup of experiences ended up um, with me deciding that, oh, I actually want to become a physician. It seems like a great job, developing relationships with patients, um, and like being able to like have the the knowledge and the ability to um, improve others' health. So that was very inspiring.
What an incredible story. I love music brought you to pursue a career in medicine and helping people. I assume that music is still a part of your life. Are you still playing the piano?
Oh yeah, I still play the piano very often. It's like a more like a stress reliever, sort of like after a long day of studying, or let's say if you had an exam, you just come home, just kind of de-stress on the piano. So
Mhm.
it's definitely been a big part of my life.
That's really great. I would love to hear a little bit more about what volunteering at the nursing home was like.
Oh yeah.
I would love
Yeah,
to.
so like our recital group, we would host recitals like, every Christmas or whenever, just kind of like every quarter we would host recitals. But I think the most memorable would be during Christmas, because it's just like very festive, and then just playing like a simple song like Rudolph the Red-Nosed Reindeer, that
Mhm.
would just bring smiles to all the patients, all the elderly patients there, and that was just very rewarding to be able to like utilize my like piano skills to spread happiness or positivity in the nursing home.
Oh, it's a beautiful story. I love hearing that. So, aside from music, what other interests and hobbies do you have? Are you doing other volunteer work, or are there other things that you really enjoy doing outside of school?
So I really enjoy fitness. Like fitness has also been a pretty big part of my life throughout college. It started like during my freshman year when I started, joining upperclassmen, going to the gym, starting to learn how to properly lift weights, the form and everything. And then I continued to maintain that throughout, college, and it's just been a great way to like, again, another, I guess, relieving stress um,
Mm.
method, because running a few miles or like lifting heavy weights it's like, what other better way to like just push everything out that's been accumulating throughout the day. um, and then on top of that, it's like fitness has been like it's like a journey. I think it's also kind of similar to medicine, where you can't achieve your goals in like a day or something. It's going to be a long process. um, and I think fitness has taught me like important lessons that I think I would be able to apply, and also in medicine too. So yeah, I don't know where I'm going with this now, but
No, that's
yeah,
great.
fitness has been a great passion. Yeah.
Yeah, I think you're kind of talking a little bit too about like consistency and perseverance and
Exactly.
resilience, and showing up even when it's hard, um, and knowing that the end justifies the means.
Right.
It's you have to have that kind of vision of where you're going, and knowing that it takes a lot of little steps to get to the result, and it's not going to happen overnight.
Right.
I think that's a great metaphor, and also just for everyone who's watching to listen to, because you can't rush your dreams, you can't rush your health, you can't rush anything. It's never going to be perfect. You just have to take little steps every day, and if you show up every day and do something, even if it's 10 minutes, you're one step closer to getting to that goal that you have. And I think, just finding the time to give back to yourself, to find ways to distress.
Mhm.
'Cause I know medical school and healthcare is very stressful, and I think it's outstanding that you have already kind of implemented these ways for yourself to figure out, okay, how can I realign myself to know I can get back to neutral, so I can like let go of all of this stress, because I know
Right.
that burnout is a thing in healthcare, and especially
Mhm.
with COVID happening right now, I know the shifts and just the frustration of everything can really eat at people. So I
Mhm.
really admire that you already at such a young age already have that in your pocket. And I think it's great advice for everyone listening to also implement into their lives as well.
Yeah, definitely. You know, like pre-med can be very stressful. Like, taking all these hard classes, organic chemistry, physical chemistry, um, and then having just like a way where you can just not focus on academics, just just cool off essentially. I think it's very important.
Extremely important, yeah.
Mhm.
So how many medical schools did you apply to, and are you still applying, or
So yeah, so I applied to around 30 med schools.
okay?
Um,
Is that
I
is 30, is that like a normal amount, would you say, or would you say that's high or low for everybody watching who maybe wants to eventually do what you're doing? Can you kind of tell us a little bit about that?
Yeah, yeah. So I think I guess if you would call it, the national average would be around 20 med schools. But then I think for students applying from California or New York, where competition may be a little higher,
Mhm.
I think those students tend to apply to like 25 to 30, a little more, so that they can have like a safe ground essentially. Um, but I'd say 20 is like the solid average of most students applying to medical school.
Okay, thank you for that information. I'm sure that's helpful for a lot of the people watching.
Yeah.
So I know that you're just kind of starting out, well, not just starting out, but you're in the more beginning phases of your medical profession. You talked a little bit about shadowing, and you talked a little bit about I think you said scribe.
Right. Mm-hmm.
Can you tell us what that is for myself and for anyone who doesn't know?
Yeah. So a medical scribe is essentially you follow the physician into the patient into each patient consultation, and you help the physician with medical documentation. So let's say, so basically, you're helping the physician focus solely on the patient's care instead of having to like deal with the documentation. So instead of, um, like some physicians, you give you you essentially give them the opportunity to solely focus on the patient, and then it's like have like let me restart this.
Okay.
Can I restart this?
Yeah.
Yeah. Okay. That was not good. All right. So
You want me
yeah,
to re-ask it?
yeah. Okay.
Okay.
Well, actually, no. I can just start off by just saying as a medical scribe.
Okay, great.
Yeah. Okay. All right.
Can we clap? And
Calm down. All right. So essentially, as a medical scribe, you follow each physician into the patient consultation, and then you help the physicians with documentation. So essentially, while they're taking the patient history, you're jotting down all the notes, like including why why the patient presented to clinic, which is otherwise known as the chief complaint, and then their history of present illness. So basically, what are they here for? So are they here for a medication refill or for knee pain or anything like that? Then you would kind of jot down the notes. And then after that, you also take a brief history of the patient in addition to like why they're there for. So you want to collect information on their past medical history or any past surgeries, and their current medications that they're taking. And then in addition to that, the physician will also perform a physical examination. And while they're performing the physical examination, you also want to, you're also responsible to write down information that the physician gets from the physical examination. So essentially, for example, if the physician tells you that there's limited rotation of move or limited range of motion of the shoulder, then you also want to kind of note that in the chart, because then the physician will be able to look back to that and say, oh, this is basically what happened during the physical examination. And then after that is essentially the diagnosis and the plan. And these two essentially happen after the consultation,
Mhm.
when the physician kind of reviews the chart with you. At that point, the physician will tell you what the diagnosis is, and some physicians will actually allow you to sort of guess out the diagnosis and then tell you if you were correct or incorrect.
Mhm.
And then so it's like a very interactive and learning process for the scribe as well. And then after that is the plan, the treatment plan. So from this point on, the physician will tell you, oh, we will do this for this patient, or we will see this patient back in a month. Then you also want to jot all that information down. And then, so that's basically the primary role of the medical scribe is, helping with documentation, um, and doing all the medical chart aspect of patient care. And by doing that, you allow the physician to, um, you know, you relieve a responsibility of the physician to have to take the notes, and then by doing so, they can focus more on the care of the
Right.
patient.
And then you're also learning so much just being a part of that
Hmm.
process.
Absolutely. You
What?
learn a ton of medical terminology, like the first day you go in versus, let's say, a few months later. First day you go in, you're like, what's hypertension? Like, what is that? And then, like a month later, you learn like all these different
Like,
like
oh, well,
different
that's
codes.
blood pressure, and let me tell you about it.
Exactly. Yeah. What's blood pressure?
Yes.
And then right.
So,
So
okay, so I have two follow-up questions to that. One would be,
mhm.
how do you find this scribe job? Does the university help you kind of through advisor, help you place you and help you do that? Or is it something you completely find on your own? And then the second question is just how long do you scribe for typically?
Okay. So for I think most scribes, there's companies out there like Scribe America or like telehealth or different types of companies. Well, they will hire scribes to help physicians with documentation. As for my case, I actually was fortunate to be able to be referred by one of my friends to a private clinic, and then at the private clinic, obviously, I was able to develop skills as a medical scribe. And then after that, um, this relates to the second question as well, but I actually worked as an intern for 1 year, and then I applied to a scribe job with a independent physician, and then that also lasted about a year uh, until COVID hit. I was actually planning on working further, but obviously with COVID-19, it was like scribes are not like essential workers, so I think
Okay.
they just only had like physicians and the nurses work during COVID. But I think, does that answer your question?
Yeah,
So
I think.
basically, you can apply to like these formal programs, but I think most people, or like at least some people like me, instead of applying to those companies, we just apply to like private clinics, and then it's more flexible with your work hours, obviously, because it's just the physician who is um, like who you just have to schedule it with the physician, so it's not as strict. And yeah, and then also private clinics offer on-the-job training, so they don't require you to take all these like classes online before your first shift. So that's also pretty nice.
Okay. So there's internships and then there's scribe. And is that the same as shadowing or scribes? Is that the same as shadowing? Is it similar?
No, so for shadowing, it's more like you're just observing.
Okay.
The physician's doing everything. You're not responsible for anything.
You're
But
kind
then
of
as a
more watching and learning, but being a kind of a fly on the wall when you're shadowing.
right, exactly.
As
So
opposed to
when you're shadowing, you're just trying to take in everything. You're
okay.
just
But when
observing the physician, how they interact. And, yeah. But
okay,
then
yeah,
for scribes, you actually have like a responsibility for part of the patient's care.
amazing.
Yeah.
That's really great information to know. Thank you so much for joining our podcast today. You've been amazing. I know that everyone watching has learned so much from everything and from your process and kind of where you are in your medical profession. And you have to keep us updated too on which
Oh
medical
yeah, will do.
you end up going into. And for everyone watching, we will link all of his Instagram handle and any information so that if you want to contact him or follow along on his journey, you will be able to do so. Thank you again, Matthew, for
Okay.
joining us.
Yeah, of course. Thank you for having me.